All right. Oh, hello. Oh, hey. It's been a while. How's it going, everybody? My name is Dr. MarkAlain Dery. It's so good to be back. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana. I live in New Orleans, and I serve as the co-chair of the ACOI Infectious Disease Subspecialty Section. Now, you may have seen me do these updates now for the past few months, and in conjunction with the leadership of the ACOI, I hope that these messages are helping you keep up with the latest on COVID-19. Now, I know many of you are in the thick of the fight, and I would like to thank you on behalf of the ACOI, as well as all of us who focus on infectious diseases for a living, for all of the work that you do. Now, moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. Before we go on to the stories, I do want to remind you that the ACOI conference is still up online. You can still get lots of great CME. Great conference on COVID. There were so many great conferences on storytelling, on social justice and medicine. There were so many great things to see. So please definitely feel free to go online, and it'll remain up for, my understanding is for a few months more. Okay, so let's get on to the stories. We're going to start talking about a big study that just came out regarding COVID-19 in pregnant women. So now a study came out on Election Day about pregnancy and COVID-19 with attention on the election. I think that some folks missed it, but since it's big news and it's one that I think it's very important, I wanted to talk about it here specifically. Now, what the CDC did, this was a study with the CDC that involved pregnant women and the risk of severe complications from COVID-19. And what they found was that overall women who are pregnant and contract COVID-19 are far more likely to have severe illness than non-pregnant women. Now, they're also more likely to be admitted to ICUs and require ventilation, as well as heart and lung support. The research team found that 10.5 per 1,000 pregnant women were admitted to the ICU during the study period from January 22nd through October 3rd, compared to 3.9 per 1,000 women who weren't pregnant during that same time period. The study involved analyzing data from almost 500,000 women between the ages of 15 and 44 who did test positive for COVID-19. Now, another study confirmed that the risk of premature delivery is higher for COVID-19 positive pregnant women too. Mortality rate was higher as well, and there was 1.5 deaths per 1,000 women versus 1.2 deaths per 1,000 non-pregnant women with COVID-19. What about infants? Well, among infants tested for COVID-19, the team found 2.6 were positive, and that infection was most common in infants whose mothers tested positive for the coronavirus within 1 week of delivery. So that makes sense. Okay, so what should pregnant women do? First of all, it's important for them to get the flu vaccine. Yes, on the flu vaccine. And to heed the warnings of masking and social distancing to prevent contracting COVID-19. While the overall risk is low, that a COVID-19 positive pregnant women will end up severely ill, less than 1%, I would still advise being smart and taking precautions. Just a couple of quick thoughts here, and that is that this is not unprecedented, and we have seen in the past with epidemic viruses such as H5N1, H1N1, of course, Ebola disproportionately affect pregnant women as well. So it's not a surprise that we would see that with the SARS-CoV-2 virus or COVID-19. Okay, so let's talk about something equally as serious, and that is and that is the number of cases we've been seeing this week, and how Dr. Fauci has been very accurate with his predictions. So this week, the U.S. hit new records in COVID-19 cases that were reported. Now, those of us who are closely following the pandemic and listening to the nation's top infectious diseases doctor, Anthony Fauci, we're not surprised, and I'm sure my colleagues, you're not surprised either. Back in June, Dr. Fauci raised the red flag. That's me raising and waving the red flag. Dr. Fauci raised the red flag, predicting that the nation would hit 100,000 infections per day if the country failed to comply with masking, social distancing, and other recommendations to slow the virus spread. Now, I'll be honest with you. That was at a time when we were at like 42,000 cases or so, and I thought 100,000 was a lot. I believed them, but I thought it was a lot. But he was right. So this week, we saw that's exactly what happened, because what he predicted 5 months ago actually happened. So telling it the way it is, unfortunately, is not a recipe for popularity. That's where Dr. Fauci and I are very much alike. I think I'm a lot like him. I'm not quite as, but we're both ID, and we see that. Don't tell him I called him. And if you're watching this, Dr. Fauci, sorry. I mean, you know what it is. Anyway, so telling it the way it is isn't a recipe for popularity, and that's where Dr. Fauci and I are very much alike. No one liked Dr. Fauci's prediction in June, and I was often met with groans when early on I gave my predictions about the length of the pandemic. That's true. I told people 2023, 2024, and no one wanted to hear the grim predictions. So where are we with the stats as we hit this grim milestone? As of Wednesday, November 4th, 2020, the U.S. counted 107,872 new infections. Let me just say it this way. We counted about 108,000 new infections, and around 1,600 Americans died. Much love, peace, and justice to those families. Remember, this is a one-day count. The U.S. averaged about 92,000 cases a day this week, and that's about a 51% increase from 2 weeks ago. Another statistic that in no way should we be proud of is that the U.S. leads the world by cases with 9.5 million cases and almost 250,000 deaths. That means that we're accounting for more than 1/5 of the world's cases and deaths, and we make up 4% of the total population. 20%, or 4% of the population, accounting for 20% of the morbidity and mortality. The states are setting some new one-day records as well, such as Colorado, Indiana, Maine, Minnesota, and Nebraska. There are currently 52,000 COVID-19 patients in hospitals right now, which, by the way, is the highest that we've seen since August 6th, and this is about a 75% increase from a month ago. So why are we backsliding? I've always believed that we should have a national mask mandate. You see me, that's an ear loop, but you don't need to, yeah, there we go. I've always believed that we needed a national mask mandate. And Dr. Fauci, who's been hesitant about such a recommendation, believed that if he urged the American people to mask, they would comply. But recently, during an interview, he said the time might be now to push for that national mask mandate, and I totally agree with him. He also said that we need to quit pushing the narrative that the pandemic is improving or will just go away. Obviously, that's not the case. And when you compare the U.S. to countries like Japan and China, which have approximately 100,000 COVID-19 infections in total as of November 5th, our case count at about 9.4 million is truly astronomical. So I must wonder where we would be if the country took Dr. Fauci's predictions seriously in June. I wish we were right here saying, boy, he was wrong. Unfortunately, the man who has served the country in the position as the director of the National Institutes of Allergy and Infectious Disease for 36 years is right. Maybe it's time to start listening to the experts. And Dr. Fauci, if you're watching, I have a lot of things to talk to you about. Will you appear on one of my shows? It'd be great. Maybe we can lunch together at some point. So stay on the lookout for the regular updates. Oh, here's my favorite part. Stay on the lookout for the regular updates, and to read more from our sources in this report, go to acoi.org/ COVID-19, together with the ACOI, will help you have the latest information to help you respond to your patients and stay on top of the crisis. As always, please feel free to reach out to me directly at madery@mac.com. Please stay safe. We can do this together.